And I did learn some valuable advice to not eat a banana before going in the OR. So that was really helpful.
Let me pull up my questions. Here we go. Cool. So wait, is this your first year applying because you're still an undergrad?
This is my first year applying.
Okay.
And I haven't done, it's gonna sound so bad because my interview's next week, but I really haven't done much practicing. I did a couple of like sit down and talk about what the interview looks like with two current PA students. So I kind of have a feel for the style of the interview, but I haven't really tried any questions with anyone back and forth.
I have some questions from last night and then we'll see where it ends up and I'll take notes kind of like we did last night and then go through them. So, okay. To start out, let's just jump into tell me why you want to be a
I want to be a PA because I love the teamwork collaboration that PAs have with different healthcare providers, such as physicians, nurses, NPs, and other healthcare providers. I also like that we can prescribe medications, possibly even run our own clinics, assist with surgical procedures, diagnose and treat patients, and so much more. That was really, really awesome to hear as a profession, to not have to go to school for maybe 6 years versus doing it in about 2 to 3 years. So that was a bonus for me, really, with the timeline. I specifically want to be a PA. I used to want to be a physical therapist, but as a patient, I had 4 knee surgeries, so I had a lot of physical therapy in my past. And it really made me realize that I don't really want to be on the rehabilitation side of things. I want to be more in the clinic and actually treating and diagnosing patients with a diverse healthcare team.
What is the most significant thing you've seen while shadowing?
The most significant thing I've seen while shadowing would probably be in the OR. It was an oral cancer patient, and it was my first day actually shadowing ever a PA and then ever in the OR. So my first day shadowing, and she actually worked in plastics. Um, it was terrifying at first because you just walk in the OR to see a patient with, I mean, half of their face was removed. And but it was really, really interesting to see, the anatomy behind what you learn in the classroom. It was really nice to actually see that in real life. And I did learn some valuable advice to not eat a banana before going in the OR. So that was really helpful. But that was the most significant thing that I've seen shadowing. I've shadowed in clinics, but they weren't necessarily to that extreme. It was more so of like common things that go on, maybe like a jam finger or things of that sort. So the OR was definitely a more significant environment for me.
What are 3 qualities a PA should possess?
PAs should be very empathetic with patients and really try not to, compare their lives and what they've gone through to other patients, but use what they have gone through in the past to kind of, you know, understand the patients on a different level and try to, let's see, what's the words? Try to really step in the patient's shoes when trying to diagnose or treat patients or just listen to patients. Another quality is listening and not trying to, already think of something to say in your head before listening and hearing out the patient. Because if you do that, you might miss something that's really important to how something happened or really just the overall diagnosis of a patient. And I also think that PAs should really honestly just be kind people and work together on a team collaborating with other healthcare providers, because it's important not only for you to step up as a leader when needed, but to also be able to work with other healthcare professionals and patients when diagnosing.
Tell me about a time that you were in a stressful situation.
That's a great question. I'm gonna take a second just to think about that. To be honest with you, I'm in stressful situations just about every day of my life. Um, I take on a lot of things, and when it comes to running 3 different organizations on campus, as well as trying to work part-time in the past and volunteering in the community and keeping up with schoolwork, it is all very stressful, but it really has taught me really good time management skills and how to, give your 100% all to each different thing that you take on, even when you're really stressed and you feel like it's too much. It's really um, the stress has helped me to keep pushing, if that makes sense. It it's also taught me to learn how to handle and manage my stress. So it's really rewarding to come home and see my dogs at the end of the day, or just go for a jog or read a book, and things like that.
What do you see as something negative or a downside to the PA profession?
Something that I see as a negative or a downside to the PA profession would probably be having to break down bad news to patients. um, Nobody likes to hear bad news, and I feel like it's such a difficult thing for anybody to have to tell someone bad news, whether, something is broken or they tore something, or any small thing could be really big news to somebody, and you just never really know how big of bad news could be to somebody. And to me, it's a very difficult thing to do as a PA or as any healthcare professional, really. But I do know that university has an ethics course, and in that ethics course, they really do try to help you break down to patients that bad information without feeling too uncomfortable about it.
So, why specifically did you apply to and want to go to our program?
I have so many reasons. I was born and raised in Georgia, so I really love my community, and I want to give back to my own community working as a PA upon graduation. The university recently added POCUS training for point of care ultrasound, and that to me is the biggest next thing. I shadowed a PA, and he worked in hand surgery, and he would carry it around like a stethoscope and just look on patients with carpal tunnel or any other like really cool, even with like a ganglion cyst on their hand, he would use it literally every single time just to show me and as an educational resource, but as well, like they just use it very often. And it's so neat to know has taken that on as part of their course material, because a lot of other programs don't have that option. It also has a cadaver lab, which is amazing. A lot of other programs are moving towards this virtual side of things, which is really interesting to me because I'm more of a hands-on type person. And I feel like once I see the cadaver in the lab and I get to feel things and look at things, and I feel like it just helps learn on a different level. Also, pass rate for their pants last year was 100%, and actually it's been that way for the past 3 years, I think. So that is definitely stands out to me, that knows what they're doing. And also, I know that their faculty really, really cares about their students, and there's more. Um, The program does require their students to volunteer in their community clinics, such as the Clinica Latina or the Christ Clinic, Christ Community Clinic, and that's a really big thing to me, to help with those underserved communities. I've already been volunteering with Clinica Latina, I think the past 2 years as a floater, taking patients to different specialties that they want to go to. And for me, it's a really big thing to give back to your community. And I love that it requires their students to do a certain amount of hours in the community clinics. So
All right, let's stop there and we'll talk about them. How do
yeah.
you feel after a few, I think we did 6 questions.
Nervous. I feel like I'm a yapper, so I feel like I just talk way too much.
I didn't know what time we started to see like exactly how long that was. Because somebody actually asked last night and I forgot to address it. How long is a typical interview? And a lot of times they are only like 10-15 minutes.
Right.
They're not necessarily 30 minutes or an hour or something crazy. So you may only get like 4 to 6 questions during that time period. But if you have multiple interviews, you do get more opportunities, more chances to either interact with other people or bring more stuff up. But that could be a pretty kind of typical interview length that you may expect.
Okay.
Um, okay, so we'll start back at the beginning. We'll start back at the beginning, kind of go through stuff. Definitely could tell passionate about Augusta. And then from your application, I know you have a bunch of experience with PAs. We talked about that some, but I think the biggest thing is going to be pulling in your experiences more and giving that context because your interviewer probably doesn't know everything about you. They most likely don't have your application. They may not be looking at it. Even if they are, these applications are 30 pages. So they're not going to be sitting there like flipping through trying to find everything. And a lot of it kind of runs together when you're looking at experiences and coursework and everything. So the more that you can provide, the more helpful that will be for your interviewer, for them to feel like they really have connected and gotten to know you through whatever your answers are. So we started with why. I would recommend too, well, I recommend this for everybody, but I would recommend videoing yourself. I think that is helpful to see how you're answering. If you're worried about timing, I didn't think any of your answers were too long, but timing yourself just to get a feeling for kind of the timing of it
Okay.
can be helpful ahead of time. And then I did notice one little habit, and I probably do this too. I know I say filler words, but almost kind of like a nervous laugh or like a nervous giggle that would come out. Clearly, I want you to smile and be happy, but it is professional. You want to think about that and make sure, I think, especially as a younger applicant, you have a little bit more pressure to present yourself as more mature, as ready when you're really being compared to people who have probably been in these healthcare careers for years and are just older than you. Granted, there are still plenty of people who get accepted right out of undergrad, and clearly they invited you for an interview, so they wouldn't have done that if they weren't interested in seeing what you bring to the table. For my class, I think our oldest person turned 40 while we were in the program. And then our youngest, she actually had finished college early and she started PA school when she was 21, which was like so young. So, I mean, I was 22, like it's not that young, but like we knew that she was like the baby of the program.
Yeah.
So I mean, there's going to be a huge range, but you are going to be up against those people who have, I mean, there's always somebody with more experience, more something, but you just want to try to put yourself on the even playing field with them. So getting into YPA. So one thing I would do, I would start this type of response or addressing this with the more personal stuff. Like
Okay.
you jumped more into like the perks, which is fine, but I liked hearing more about like, oh, like I had some injuries. I thought I wanted to do PT, decided I wanted to be more clinical. I think that is a better way to start because it's more personal to you and really what brought you here. So making sure that point comes across as your primary, like I had this insight personally that this would be a better fit for me kind of approach. And then gain into some of those other things you've seen, the teamwork, collaboration, prescribing, talking through some of that. Some of this is a little bit nitpicky, but when we're talking about the length of the program, you just want to make sure it doesn't sound like you're comparing or, for lack of a better term, taking the easy way out. If there's a reason that you like that it is shorter, that there's less schooling timeline stuff, like if you were 35, I feel like that makes sense to say, like, hey, I don't want to commit to med school and residency right now. But when you're just out of school, I need to understand why more that that is something that's important to you. What are your goals? It's fine if that's a reason, but why is it relevant to you right now where you're at? The one thing I'll also be cautious of, and I know you shadowed someone who does this because this is a controversial thing in the space, is the running of your own clinic. Depending on who's interviewing you, that can be seen as a red flag. And you could be questioned, well, if you want to run your own clinic, why don't you go to med school?
Right.
So if you want to use that as a point, which is fine, be ready for that line of questioning and being able to address it. You just want to tiptoe around that a little bit, and you can feel it out with whoever's interviewing you too. If they give you some insights into their practice, that might help you to kind of know how they would respond to that a little bit more too. But yeah, I think again, like throughout all of this, just make it as personal as possible. Pull in your experiences as much as you can. Then we got into what has been your most significant shadowing experience. And I think one thing that would be helpful here, and just to keep in mind for all questions, is like context of timing, because that will help your interviewer understand like how long you've been doing this. So if you said, 3 years ago or my freshman year, like saying especially that's your first shadowing experience, like when was that? At what point did you start pursuing that? Because it's going to be a lot different if it has been over a course of time versus you're like, last month was the first time I ever shadowed, and all of a sudden I'm applying to PA school, which people do. One of my best friends in our program was pre-PT, and she had applied to PT school and then decided PA. And so very last minute, like 2 days before the deadline,
Wow.
decided to apply to PA school. And yeah, ended up she was like the last person accepted. So yeah, that's a very common path and switch. But for her, she couldn't say like, oh, I've been wanting to be a PA for, all of undergrad. So being able to say that and show that timing can be helpful. Especially if the person has gone to the program or is local, that is good to name them and try to make that connection. I don't personally know that person, but faculty may know them. And then gave us what you saw as far as the OR, what that was like, appreciating the anatomy. I would like to see a connection to what your takeaways were about the PA profession. And this is something I see on applications a lot in like experience details and essays too, where there's a lot of focus on the medicine. I saw open heart surgery. I learned how to do open heart surgery, stuff like that. And those are amazing things, but what did you learn about the P? Like, what was she doing? What was she able to do? What did that teamwork look like? When we're talking about shadowing, the goal is not to learn about medicine, it's to learn about the PA profession. And so I want to know what your takeaways there are from getting to spend the time kind of observing what the PA's role was. Does that make sense?
Mhm. Sorry, I'm just writing.
Oh, yeah, no, take notes for sure. 3 qualities a PA should possess, which I agree with these. I think you made your 3 points, which is important to you. Sometimes people like merge them all together or they'll kind of get off the rails. So I like very clearly knew what your 3 points were, which was great. A couple of things to think about is you could potentially bring in your personal experiences. So if you haven't talked about your shadowing stuff, one thing that didn't come up was like patient care experience at any point. So you could even relate it to yourself and your patient care and being able to say, these are things that I try to practice even now. When I'm interacting with patients, when I'm volunteering, whatever, like make it so that you're showing like these are qualities that I appreciate and recognize, and I'm trying to already start to emulate myself before I even become a PA. Okay, stressful situation was next. It's totally okay to think for a second. That was not long at all, like totally fine. So kind of gave some more general examples. So this type of question, I would try to think of a specific time to illustrate what you're talking about. I think you'll be able to provide more detail there. So if you're able to say, instead of I was running through organizations and working and volunteering, if you can say, like, last semester, there was a week where everything fell at the same time. I was leading a meeting as the pre-PA club president. I was doing this with this organization, doing this with this one. I had a shift volunteering at the Latina clinic, and I was working part-time. And it was finals week, whatever. Like, all of these things happened at once, and I did feel overwhelmed and stressed out, but I also feel like I have fairly good time management skills, and it's something I'm continuing to work on. And so I was able to prioritize and delegate some of those things out to other members of the clubs and the organizations and ask for help and make sure that I could focus on everything enough to still do the things that I had committed to. Does that make sense?
Yes.
Okay. So it's the more specific you can be in every situation, the better.
Is it bad to say? So the interview is next Friday. Is it bad to say like on that day, like if I get asked what's a stressful situation, could I say like this week? Like because I've had like 4 meetings and like everything. I don't know if that's too like recent.
Yeah, I don't like necessarily say it's too recent. I don't know if it's the best illustration since that's kind of like a one-time thing. Like that's not your like normal stressor. And the goal of this question would be to really just see how you handle it. Like what can you handle stress? What do you do? Because clearly in PA school, you're going to be stressed out. You're going to have tough times. You're going to have, or if you go the route of being in a stressful situation with a patient, you're going to have those situations again too. And that could be one too. It could be a patient who was mad, or like you said, breaking bad news and having to be involved in that. Something you saw with shadowing, really anything that would illustrate your response and how you handled it. So there's things you kind of can think of ahead of time, but some of it's going to be on the spot. You can have your ideas of things that you want to talk about, your experiences you want to pull from, but because we never know exactly how you're going to be asked things, you do kind of have to pull. And it may be that something recent is what comes to mind first. And then it's just about how you explain it and how you show what you did in that situation. Okay, so this is the difficult one. What is something negative about the PA profession? I like this type of question because it's very, very open and you can take it like a lot of different directions. And I agree, like breaking bad news to patients. The one thing I would say somebody could come back with on this one is that's something that is not specific to the PA profession. That's just part of medicine. So whether you're a nurse, a doctor, whatever, like you're always going to be doing that. So like what would be something specific about the PA profession? And you know, they can always come back with more questions and expanding on things you've said. But I agree. This is one that like at this point when you said that, I was like, I don't have any context from the interview of what patient encounters you've had that you would have had to break bad news. So that would be again like telling me about some of your experiences, letting me know like context of situations you've been in that you've witnessed. Now it could be, yeah, personal or patient care, volunteer, lots of different places to kind of pull from. And then the last one, clearly done your research. I think you did a good job in this question of telling me what you liked about the program and why it was important to you. Like keep that mindset throughout. So saying I want to do a cadaver lab because I just tend to be a more hands-on learner and I think I will learn that better. Like that's a good personal reason to you of why that's important. And same thing about like wanting to volunteer, already doing that, wanting to continue that, the POCUS training and any public school really, they have great resources. So they get to do things like that, like the cadaver lab and the training and like sim lab stuff that maybe some other programs don't get to do. And that's great to highlight that you know about those things, are interested in those things, and looking forward to them. That was all of our questions. What questions do you have?
I just, I know I'm young and probably one of the youngest interviewing. What is your advice to not seem like immature? Because I'm not like an immature person,
Yeah.
but I don't want to give off the vibe that I am not serious about this.
Yeah, I mean, I think as long as you dress professionally, wear your suit, all of that stuff, appearance is part of it, and just looking the part essentially, looking professional, and part of it's just presenting yourself, I guess. So like I've talked about in other ones, like sitting up straight, like active. Like when I sit in my computer, I just like lay back. I'm not really like super active, but like make sure you are like active leading up to your interview, just really thinking through and be more specific and more complex with your answers. If you can show that you've truly thought about these things, I think that comes off as more mature versus giving more like of a superficial, shallow answer. Not saying that it's shallow, but it just, if it could apply to anyone, it's probably not going to leave much of an impression.
Yeah.
To leave an impression, you need to give more of yourself. And so that's going to be coming from your experiences, things that you want them to know, your stories, your examples. And really, this is your one chance to leave all that on the table. And it's hard. We don't like to talk about ourselves at all. Like, it's very difficult. And so, for this one moment, you just have to do it. And you have to get yourself in that thought process of, instead of thinking, oh, I'm young, I don't deserve to be here, think, no, I do deserve to be here. I've done so much. At one of my interviews, one of the interviewers was very, very kind. And I was in undergrad, I was in my fall semester, just like this. And I remember she kind of stopped in our interview and she had my application and looked at me and she was like, I just want you to know that I can see everything you've done during undergrad and it's been a lot. And I want to acknowledge that. And so I appreciated her doing that because you do feel like, oh, I haven't done enough. I should have been doing more. I should have been doing more. But for her to actually say that, she didn't have to do that, but it made me feel validated of like, okay, whew, like I've been seen. She does think I'm okay to be here. Like I'm not an imposter.
Right.
And so I really just appreciated that and it stuck with me. So that's like when I look at applications, and that's why I encourage you to use all of your experiences because I like your application. There's so much good stuff on here. Like talk about all of it and bring it all up.
That's why it's so hard. I feel like there's so much. I don't know what to bring up in what places, or if I'm being repetitive, or if
Yeah.
like,
So I would say if you brought something up, try to cross it off the list and bring something else up
okay,
and just get as much in there as you can.
is
Yeah.
it bad to bring up things? I'm sorry, I keep asking questions
No, you're fine.
that I didn't have on my application, but I'm doing now, like
No,
research or
that's
okay,
fine. Yeah, totally. I don't, they used to, some schools will do like kind of a like check-in, where they'll kind of ask you, like, is there anything updated or different on your application compared to when you submitted? And then you can actually tell them like, oh, I'm not in that position anymore. I'm doing this now and give them those updates to make sure everything's recent. Yeah, that's totally fine.
yeah.
Yeah. Well, I'll have fingers crossed for you. And hopefully it won't be too scary, but
I feel like it's just so awkward because in person you can shake their hand and be like, "Hi, how are you?" And
yeah.
mine it's like, "Hi."
It's a little different. I mean, I think everyone's so much more used to it now, and maybe it takes some of the pressure off a little bit too. I don't know if it really does or not. I'm still a little bit torn about the virtual versus in-person interviews. I think they're more convenient on a lot of fronts, but it is different than getting to actually go in person.
Right.
Yeah.
If you if you got asked why you think you're more qualified or why you think you're more deserving to be in the program compared to other people in the program, how would you go about answering that? Would you say that you think everybody's deserving, as we all got interviews to the program, and then go about like speaking for myself? I know that I'm extremely hardworking, and then give examples of how I've done that in the past type thing.
Yeah, I think that would be a good approach. Personally, I would focus more on me than anyone else. Like I can't speak for anyone else, say whether they're deserving or not, but I can say that I feel like I deserve a spot here because of the time and effort and everything I've put into getting here. And then going into sharing a little bit about my experience. That's even an opportunity to share why you want to go to the program, why you want to stay in the area or be in that area, be in that location. I see that as your almost like Hail Mary opportunity to leave it all out on the table. I was asked, did you apply anywhere else? And that's a common question. I mean, it comes up. And I use that as my Hail Mary to say, yes, I did. Yes, I did apply elsewhere. I want to be a PA. I'm going to be a PA whether I go here or not,
Right.
but I want to go here. And this is why I think this program is the best fit for me, and I'm the best fit for this program. You have to go into it with that confidence
Mhm.
so that they do feel like you're going to be a great PA student, you're going to be a great PA, and you are ready to take that on. Like they don't want people that they have to handhold or who aren't capable or going to take a lot of resources. They want people who are like ready to jump in, do
Right.
it. And I think you have an advantage a little bit as being a younger student or still an undergrad. So for me, like I felt like I was still in school mode and I could just kind of go straight in. I felt if I took a longer break, it would be harder for me to come back to it. But I could say, like, I'm in study mode right now. I'm in school mode. I think it will be a much smoother transition for me to continue that and to go straight into PA school. And I feel like I've had enough patient encounters to know that I want to work with patients. I want to do more with patients. I don't feel like I need more time to figure that out. And so I felt ready to start PA school because that's what a lot of people say. Like, you're young, why don't you take a break, get more experience? And I didn't feel like
Don't
I
want
needed to. Yeah, like,
to.
I didn't feel like I needed to. So,
Yeah.
well, they may feel differently, but if you go into it with that confidence, that can make a big difference.
Okay. Would it be bad to mention that, like, I've been going to the information sessions since my senior year of high school, and like for the being deserving part, like saying that like even though I am young, I've done what people typically take 4 years to do to get their prereqs and everything in 2 years. Is that I don't want to come off as like conceited. That's like my worst fear is that
Yeah.
like
So I tend to shy away from bringing up anything that you feel could be perceived as a weakness
okay,
and focusing more just on the positives.
okay,
And so I think there's a way to do that. So I don't think you have to say like, "Oh, I know I'm young." Instead, just say, "I have put my head down. I have worked really hard. I was able to complete all my prereqs in 2 years, and I feel like I took on a huge course load." Like just focus on what you did and not like I feel like I'm too young, or I know I've been out of school a while, or I don't have that many shadowing hours. Like anything that, you're looking at your application and be like, oh, that might be a weakness. Just don't point it out, but talk about the good stuff instead.
okay.
That makes sense?
Yes. And what for like a weakness? Like if you got asked like what your biggest weakness, would it be bad to say that to take it from like someone else's point of view of what you think somebody else would say is your biggest weakness?
I think you can.
Okay.
Yeah. Or just say like, I've been told and I do think that blah 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 blah
Okay.
is something that I need to continue to work on.
Okay.
A lot of it's just in phrasing, and that's where the practice comes in, is like figuring out because you can take the same information and kind of reshape it and rephrase it to fit in a lot of different ways. And so that's where like just continuing to like work on practice questions and video yourself will help you to get to where you feel comfortable with it. Okay, perfect.
Yay, thank you so
You're
much.
welcome. Good luck.